New data from the Public Health Agency of Canada released today also shows the number of flu outbreaks across the country is rising. To give us a sense of the surge and what can be done to lower the risk as we get into the holiday season, I want to bring in Dr. Jennifer Vines. She's the Medical Director of Public Health Response at the BC Centre for Disease Control. She joins us now live from Vancouver. Dr. Vines, thank you for your time tonight.
Good afternoon. Thanks for having me.
Okay, so flu cases rising as we head toward Christmas, and this is happening right across Canada. I don't know, this seems like this happens every year. Should we be surprised here?
You know, the fall and winter seasons, the colder months, are what we consider respiratory season, where there's actually several viruses in the mix. This year, I would say influenza really has our attention because of the steep climb week over week, really starting since the middle of November, and several of our indicators of flu activity, definitely among children, but also affecting older adults, and always a risk to anyone with underlying health conditions. So we're seeing a bump also in respiratory syncytial virus, or RSV, but I think influenza here is the main one of concern at this moment.
Okay, and we've now heard from specifically the province of Alberta talking about emergency rooms becoming, they're at least under strain because of the number of influenza cases that they're seeing. You're in British Columbia. Could the same be said for this province? What's the situation in BC?
Yeah, so I can't speak exactly to what's happening on the ground in emergency departments, but when we look at one of our flu indicators, which is the proportion of emergency department visits for respiratory illness, we see almost 1/3 among children, so those under age 19 coming in complaining of either fever or cough. So that's tracking with roughly where we were around this time last year, but it is definitely a signal that people are sick and seeking care for respiratory type symptoms.
It was probably several weeks ago, at least at this point, that we got word that the flu shot this year might not be a best match for this year's strain. Still could be good, but maybe not best when it comes to trying to protect against the flu. Where do you stand on that? And would you still recommend people getting a shot? And let me say, I mean, as we are now in a situation where the cases are starting to spike, are you too late?
Yeah, so let me start first by saying it's never too late to get an influenza vaccine, and I am a strong supporter of influenza vaccine this season. I do appreciate the chance, though, to talk about what people are dubbing a mismatch in this year's vaccine. So at the moment, one type of influenza that we call H3N2, that's a name for its proteins, is actually the predominant virus. We know that H3N2 dominant seasons tend to be worse. There tends to be more illness, and there tend to be more severe outcomes, particularly among older adults during H3N2 seasons. The mismatch word comes from a look at a particular evolution of one version of the H3N2 virus that we call subclade K that has changed in a way that has actually made it different enough from the version that's covered in the vaccine for it to be a concern. So we are flagging it so people know. That said, seasons with a quote-unquote mismatched vaccines, the vaccine still offers important protection. We don't know exactly how much protection it can offer until we get into the season and start to look at the science of how well the vaccine is performing. But as far as protection from the most severe outcomes like hospitalizations, we still definitely support the vaccine. And we also point out to people that it covers an H1N1 version of the influenza, which is in circulation. And you also get protection from an influenza B virus. So again, not too late, and especially with the holidays coming up and all the wonderful mixing and gathering and things people want to do, this is an excellent time to get the influenza vaccine if you haven't already.
Okay, Dr. Jennifer Vines, thank you so much for that advice. That is Dr. Jennifer Vines, Medical Director of Public Health Response at the BC Centre for Disease Control. Thanks.
My pleasure. Thanks for having me.